Welcome to the Grateful Life webcast. I'm your host, Ashley Eicher. On today's show, our topic is Mental Health Spotlight, What Seniors Should Know, with our guest, Dr. Gretchen Moran Marsh. Dr. Marsh is a clinical psychologist specializing in anxiety and depression-related disorders in teens and adults. She currently splits her time between private practice and public speaking. Last year, Gretchen was recognized by her peers, winning the prestigious 2023 Emerging Pioneer Recognition Award from the Michigan Psychological Association for her work in bringing mental health education and workshops to organizations, schools, and companies, both domestically and worldwide. Dr. Marsh, thank you so much for joining us today to discuss this very important topic.
Ashley, thank you so much for having me here. I'm so pleased to be here to talk about a topic that is near and dear to my heart.
Absolutely. We are so glad you are here. And for anyone that is watching at home, we are going to have a Q&A towards the end of the program with Dr. Marsh. So if there's anything that you want to know or any questions you have for her, make sure you put those into the chat. So Dr. Marsh, you have been a clinical psychologist for over 20 years, specializing in anxiety and depression disorders. Would you mind sharing just a little bit about how you became interested in mental health for seniors?
I'd be happy to. When I was an infant, my parents divorced. My mother moved home to her parents' home, where my sister and I were raised by three parents: my mother, my grandmother, and my grandfather. Now, lots of people thought this was a disadvantage, but I actually embraced it. You see, I got to grow up in a multi-generational household. My grandparents were born in 1918, so I got to learn some great valuable lessons from things that they went through. I got to learn about perseverance and grit going through World War II and the Great Depression. My mother was born in 1948, and through her experiences, I got to learn about acceptance and social awareness for all the things that happened in the 1960s and 70s. Funny enough, when they weren't able to watch me, I was sent two doors down. I'd ride my bike down the street where my great-grandparents lived, and they were born in 1893, so that was a whole totally different generation. So I spent so much time around the senior community, and I adore and love them.
I love that you had the experience of being around so many different sets of grandparents. That is such a gift.
It really was, and I cherish it, and I miss them terribly. I think about all of them quite often.
Well, today we're talking about mental health. So can you sort of set the stage for us? Where is mental health today, and how should we be approaching it?
That's a great question. So, mental health is our emotional and psychological well-being. And it's been a long ignored topic in our society. And the problem is that mental health affects how we think, how we feel, and how we behave. And we need to approach it like we do physical health, in a deliberate and a consistent manner. For example, I think the medical community has done a great job telling us how to take care of our physical health. For example, if we have a predisposition to heart disease, we know exactly what to do. We know we should exercise, eat foods that are low in cholesterol, low in salty foods, and highly processed foods we should stay away from. If we have a predisposition to anxiety or depression, do we know what to do? I think we should. And I think that the medical community and the psychological community has kind of faltered in telling us that, for example, if you are feeling anxious, avoiding something that makes you anxious only makes you more anxious. We need to follow the data and sometimes ignore how we feel and face our fears when coping with something like an anxiety disorder.
Absolutely. And I think that's across all generations. That's not just for seniors, which we're mostly talking about today, right?
Exactly. It is true of all of young people, of middle-aged people, and of the senior community.
Well, and for me, I feel like older generations have tended to approach mental health by just sort of shutting it down. I know at least in my family, it was just something we did not talk about. And I think a lot of that goes back to how it was viewed when they were younger. So can you talk just a little bit about that from your experience?
I think that's definitely true. You know, older populations were taught that mental health and mental illness was a weakness or a deficiency in your character, and therefore it had a terrible negative stigma. Those populations were told to ignore their feelings and get the job done. And while that did have some benefits, sometimes our emotions can give us false information. But here's the problem. When we have a stressor and we ignore it for too long of a period of time, it can also turn into something bigger, like an anxiety or a depression. So today we really need to focus on understanding what is the root of why we're feeling the way we are.
Absolutely. I absolutely agree with you. How has that carried into the current stage of life for seniors in the world that we're living in today? Because I know that you see this in your practice on a regular basis.
Yes, some people like to ignore the stressor, and I can totally understand that. But if it becomes bigger, then we've got a more of a problem. Here's an example. Seniors tend to prefer routine and predictability, and I can understand that. It brings peace. But sometimes if we live too predictable, too much in routine, we limit our experiences and we can limit our joy and our interactions with others. And that can lead to a bigger problem like having a depression.
Well, and I think so much about veterans and what they have witnessed and so many terrible things that they don't talk about whatsoever. And although VA support has changed in more recent years, older veterans may not have the same level of mental health support or resources as modern veterans. Do you see that too?
I do. I think that, because mental health had a stigma, it also had a stigma in the veteran population. Veterans were told to kind of just brave through it and stick up and have a stiff upper lip. And we're knowing that, through the veteran populations that now they've started to address mental health problems. And here's what's kind of interesting is that we didn't know this in the past, is that veterans who experience a trauma, experience a traumatic event, 80% of them will bounce back on their own. But 20% will need further treatment. Now, what might that look like? They might benefit from going in and talking to someone or having some medical therapy. The Veteran Association has done a great job in reducing that 20% by half so that the population is really able to resume their lives and so that the trauma they experienced can be something that they can kind of put into their past and that they're not dealing with on a day-to-day basis.
Well, and one of the things I think that we know now too is that shame lessens when it's spoken out loud. So if you are someone watching this that feels like you are struggling with anxiety or PTSD, whatever that is, say it out loud to someone that you trust, and that can help you to work through this process and get the help that you need.
I think that that's so very
Yeah.
true. We find that people that suffer from the same common problem, when they can talk to somebody else who has also suffered from the problem, it normalizes their reactions. They think, oh, well, wait a second. I felt so awful when that happened. Well, wait a second. I did too. Oh, you did? Yes. And they can be a commonality. So it normalizes it and it tends to bring the symptoms down. And also, we find that if people can share their experiences, the social support that they receive from others boosts their self confidence and lessens their symptoms.
Well, and again, so often I think that we think it's just we're the only ones going through it. And when we actually share our stories with other people that we trust in a safe space, you realize other people have gone through something similar and we can help each other. So, okay, we've talked about what mental health is, but now let's discuss a little bit about how we should care for our mental health. What is something someone could do today to improve their mental health?
So I say this to every single patient that I see. I ask everyone to check in with their self. Self is an acronym that stands for sleep, exercise, leisure, and food. If you're feeling a little off, if you're feeling a little blue, a little anxious, be sure to check those four domains. Now, S stands for sleep. Are you getting enough sleep? We know that adults, seniors need between 7 and 9 hours of sleep a night. Now, why is that? We have found that sleep is essential for optimal cognitive functioning. It's also for memory, for coping, for regulating your emotions. We also found that sleep has a component in your physical health. People who don't get enough sleep tend to have increased rates of cardiovascular disease, dementia, and even cancers and getting viruses. So be sure to check your sleep. I'd love to tell you a case study of a patient of mine that I saw several years ago. It was a
Absolutely.
it was a senior man, and he came to me because he was suffering from terrible anxiety, and it was manifesting itself in a fear of vomiting. So you know what he did? He quit eating. Now, this was especially problematic because he was also a diabetic. You see, he had to eat to regulate the sugar levels in his body. Now, by the time he got to me, I was his second psychologist, and he was on several anti anxiety, antidepressant medication. And I did a full psychological evaluation on him. And I asked him about his work history, his relationships, his eating patterns, and then I asked him about his sleep. And I found out that he had a sleep disorder. He wasn't getting enough adequate sleep. So instead of treating the anxiety, I skipped it. I just treated the sleep disorder. And when he was able to return to a normal amount of sleep between 7 and 9 hours, the anxiety just went away. Here's what happened is he didn't get enough sleep to cope with the stressors of his daily life and he was feeling anxious. So sleep is essential. So number one, if you're feeling a little off, check your sleep. The second one, oh, yeah, the second one is exercise. E stands for exercise. Are you moving your body? Now, our physicians, what do they say? They say, Gretchen, you should be moving 3 to 4 times a week for 30 to 45 minutes a day. And I said, you know what? I think you're wrong. I think you should be moving every single day. And here's why. Because when you exercise, endorphins get released in your brain, and these are pleasurable hormones, and you start to feel happier. So who wouldn't want that boost every day? I know I need it. I know I need it when I transition from my work life to my personal life. I need to go for a walk, get on the Peloton. Sometimes we pull the ping pong table out, and I do some sort of exercise. Now, I told you my difficult time of the day is that 3 to 4 o'clock hour. If your difficult time of day is in the morning, maybe you should consider exercising first thing in the morning to get those endorphins in to release in your brain. So it's sleep, it's exercise. The L stands for leisure. Are we having enough fun? I think American culture is a little bit backwards. We delay fun for a long period of time. We delay it till the weekend, don't we? And here's what I hear from my clients. Oh, Gretchen, it's the Mondays. So Tuesdays, okay, Wednesday, I'm going to make it hump day. Thursday's Friday Eve, and Friday, here I go. And what do? They overdo it. They tend to stay up too late. Maybe they drink too much. So then they have recovery for a day, day and a half, and then we go back into the cycle of the Mondays. I'm thinking we should have fun every single day. So go play cards with your friends, or go play golf or pickle, or go for a walk, something fun every single day. And the last one is food. Food we should be thinking of as medicine. What are you putting in the tank? Now, we know that some foods are culprits to negative mental health. No one's going to like this one, Ashley, but I don't think you're going to like it either.
I feel like I know where you're going with this, Gretchen.
I know where you're going with this one.
I'm not thrilled.
I know. But caffeine is a culprit in increasing your anxiety. Here's how it works. When we have caffeine, what does it do? It makes us more alert. Our blood pressure goes up, our heart rate goes up, and some people who are feeling anxious tend to interpret that as being more anxious. So if you're feeling anxious, cut down your alcohol. Cut down your caffeine. We're going to get to alcohol.
Also alcohol.
Yes. The second one is alcohol. Now, nobody likes that one either, and I enjoy my own glass of wine. But if we look at the data, alcohol has been consistently related to anxiety and depression. This is decades of research. So consider cutting back or eliminating altogether. Now, other foods that are culprits, we know that sugars, processed foods, high fructose corn syrup is another one. What should we be eating? We know this. Our green leafy vegetables, legumes, our nuts, those sorts of things. So like I said, every day check yourself, your sleep, your exercise, your leisure, and your food. And I can guarantee it'll start to improve your mental health today.
Well, it really is. We talk about caffeine. It's that reverse psychology almost on caffeine, where you think that it's going to give you that up for the rest of the day. And then typically, I feel like probably if I have a good cup of coffee in the morning, maybe around 2 or 3 o'clock, I start to crash. I don't know about anybody watching at home, but that's me. So why is it important to exercise at the most difficult time of the day? Because like I said, 2 or 3 o'clock is about the time that I start to want to crash a little bit if I've had caffeine. And what are some of the exercises that could be considered exercise for our senior population?
Yes. So exercising during the most difficult times of your day is to get those endorphins on your brain, those pleasure hormones. You'll feel better. Now, what can they do? They can go for a walk. They can play golf, any sort of movement. Gardening is a great one. It doesn't have to be a boot camp or a high interval intensity training program. It just has to be getting your heart rate elevated and walking around for a period of 30 to 40 minutes. I guarantee you will feel better. I've actually never known somebody who felt worse for having gone for a walk. They always come back and say, I feel better. I was outside. I was moving my body. So consider doing it during the most difficult times of your day.
But I also think there's so much research around just going on a walk after you eat just to get your digestive system moving. And the way I like to think about, my body and what I take into it, I'm like, what is nourishing for me? And you touched on that when you talk about food, which I think is so important. But another thing for me is just practicing gratitude every single day. Do you see
Exactly.
that in your practice too, of your
Yeah.
patients that practice gratitude, how it improves their mental and emotional health?
Yes. So, like I said, I have all my patients practice the self, right? Sleep,
Hmm.
exercise, leisure, and food. But I also have them practice gratitude. And here's why. The research says that if we focus what's going right in our life, we have less energy to focus on what is going wrong. When we have a thought, we build a neural connection in our brain. And the more we do that, the happier we become. So if we focus on the good things, the right things, I got to say, my grandmother told me it was counting my blessings, that we will feel better. Now, I have my clients write them down on a piece of paper, three things. I actually have my children write them on their bathroom mirrors so they can kind of be inundated with all the things that are going right. And it's great because then they go in there, they get dressed, and they end up reading a one or two of them to remind them of the good things that are going on in their life.
Well, and I think it is so important for us to acknowledge the positive side of mental health. And I think for me, it's really easy to get online or get on Instagram, Facebook, social media and start to see or watch the news and it just feels like everything is so negative. But for me, if I can sit down and write down 10 things that day that I am grateful for every single morning, and sometimes I have to refer back to that list. And I
For
think that's
sure.
really important if you need just that check in throughout the day. But it can feel like everything in our world is so negative and that impacts our mental health. So the more that you can check in of what are the really incredible things I have in my life right now and the people that love me and that I love, or the other things that you're grateful for. Sometimes you just have to do it throughout the day too, but that practice really starts to train our bodies and our brains to think about life from a gratitude perspective as opposed to not. And I
I
want to
think
talk
you're
more
right.
about this for sure. I'm sorry, what were you going to say, Gretchen?
I think you're right. And I think you made another great point there is we are inundated with a lot of negative feedback from the news, from our world. I mean, there's been a lot of difficult things going on in our world with wars or political divides and all that. And we need to know when to shut that off and not
Absolutely.
tune into it. I find people in my practice, and the research supports this, that people who are attending too much to the news or the negative things will start to internalize what's going on and feel negative. So I definitely say, you know what? I love and enjoy watching the evening news, but that's about it. I don't watch the news segments all day long because it is full of so much negativity. And I think we're about to go into a very combative point in our history right now. We've got an election coming up, and that can be very sensitive for people with kind of the back and forth between the two sides.
Well, and I can tell you, I'm diverting for 1 second, but I have a master's degree in mass communication. And one of the things that we talked about in grad school was the way the news is presented, the way advertising and all of that works. Negative makes you click and stay in longer. And so I think that's why we see so much negativity in our news. So again, if you need to step back from that to protect your mental and emotional health, that is a good thing to do and just focus on being grateful for the people in your life. And so let's talk just a little bit about checking in with our loved ones because I want to make sure that we cover this. What if you're a caregiver or have a loved one that you might be concerned about? How should we go about checking in with them to get them going in a more positive direction?
That's a great question. So we got to remember that because mental health has a negative stigma, it might be a sensitive topic. So we really need to meet somebody where they are. So that might be just asking an open-ended question. Hey, mom, how are you doing? How was last week? What are you up to this afternoon? And just kind of starting to get the ball rolling on somebody getting talking. Now, some people might automatically talk and fill in and tell you all the different feelings that they have. And some people might not. They might back off and say, I'm fine, things are fine. What if you just do that, you've planted the seed of caring about somebody and showing that you have concern about them. You can always circle back. So really, I like the idea of open-ended questions, but also be respectful of somebody that they might not want to talk about it. And that's okay too. You've communicated care and concern just by asking.
When I think it's just planting that seed. It's planting that seed and letting someone know that you care. And they may not be ready, like you said, in that moment, but they might in a week or 2 weeks or something like that. So I think it's really just being aware and paying attention.
I think you're right. And then circling back, you
Yeah.
can always circle back to any conversation. Say, if you said to your mom, I see that you haven't been out very much last week. or the week before, and let's say she's resistant talking about it, you might come back a week later and say, "Hey, mom, I'd like to talk to you about what we started conversation last week. Would you be open to it?" But
Yeah.
always be respectful of where somebody is.
Right. And it doesn't have to be perfect. You know, it's one of the things I think a lot of counselor friends of mine talk about is like it's okay to not be okay, and it's okay to talk to people that you trust about it, or to sort of, you know, if you are a caregiver, again, like we said, planting that seed and continuing to follow up in a way that helps people to feel safe. I think not attacked, and it's a very delicate balance. So, you know, I also think about the relationships in our lives that sort of evolve throughout our life. How important are relationships? And I feel like I know where you're going to go on this, Gretchen, but how important are relationships to our mental health?
Well, relationships are really the key to happiness. So, I'd like to illustrate this by telling you about the Harvard study. The Harvard study was in 1938, and it's the longest longitudinal study of human beings in American history. Now, what that means is it followed the same people over time, and it actually still going on today. And it looked at two different groups. It looked at Harvard undergrads in 1938 and compared them to inner city immigrant Boston kids. And it asked them everything. It asked them how much education they had, how successful they became in their careers, how far up the social ladder they went, how far down the social ladder they fell, how much money they made. It looked at all these different factors. And it found the number one factor at predicting health and happiness was close personal relationships. Now, I always get this question, Gretchen, I didn't have close personal relationships growing up. Does that mean that I can't have this ultimate happiness that you're talking about? And the answer is no. We have found that those relationships can happen at any time in the lifespan. So if you didn't have them growing up, or when you were in school, or when you were post school, you can develop them now. And we know this is a fact because we've looked at senior communities, seniors who get involved in the other seniors and develop close personal relationships by going out and spending time doing a common activity. Not only are they healthier, but they are happier. They have less rates of disease and they have better outcomes. They actually live longer too.
Well, I think you just have to, you know, as we age, like you were talking about, it can be hard for some people to find new friends, or it can be scary to build new relationships. But I think you just have to put yourself out there and find a place where you can build those. Is that at church? Is that playing games? Is that, I don't know, you probably have more ideas than I do, Gretchen. Can you throw out some ideas?
I think you've got some great ideas, Ashley, but I think you're right. Sometimes it's hard to form a new relationship.
Yeah.
So having some sort of activity or something to attend, to go to watch can kind of create a common bond. So you might go to and listen to some like a piano concert. You might go and join a golf league. You might go to coffee time or something like that. And then here's the key. Even if you don't feel like it, I really encourage you to reach out to somebody, start a conversation. It's that starting the conversation that can really start to build a relationship, which builds happiness. When we talked about also there's the idea of doing something for somebody else in this topic as well. If we reach out to somebody and we pick them up a cup of coffee on our way into, a meeting or something like that, it automatically starts a conversation. A conversation starts a connection starts a relationship, and relationships are happiness.
Yeah, absolutely. So the older we get, the more likely we are to lose a spouse or a partner, which we all know. How does that contribute to feeling isolated or lonely? That's something that I saw in both of my grandparents as they got older.
Yes, I think losing a partner or losing a spouse can be absolutely devastating, and it can result in grief. And what it also results in is being alone. Now, alone is a physical state, right? But being lonely is an emotional state. That's the desire to be with others, but not having the option to. And the US Surgeon General has just declared loneliness as an epidemic in the United States. And this is across the board. This is with younger populations, middle age, and senior populations, with 1 in 2 people reporting being lonely. Now, this is especially problematic because of the negative health effects of being lonely. We know that people who are experiencing loneliness have increased rates of depression, cardiovascular disease, anxiety, and depression. It's as bad for your health as smoking 15 cigarettes a day.
Mm,
And it's worse for your health than actually having an alcohol disorder or alcohol abuse disorder or being obese.
mm.
So loneliness is really negative for our physical and our emotional health.
Absolutely agree. Before we get too much further, for anybody that's just joining us, I also want to make sure that you know we are talking about mental health today, what seniors should know with Dr. Gretchen Moran Marsh. And if you have questions for Dr. Marsh, we are going to ask those towards the end of the program. So make sure you put those in the chat. Or if you are a caregiver that is caring for a senior or another family member, friend, and wants to ask a question about mental health, please put that in the chat. We were just talking about if someone loses a partner or a spouse and how difficult that can be in contributing to isolation and loneliness. But how might finding a new activity or even a new romance or new friendships, how can that help improve someone's mental health?
Well, just think about it. Let's say you lose your partner and you are devastated and you're feeling lonely. That means you thrived in relationships. So we need to continue on and have more relationships. Now, I don't want to discount it. It could never be the same as the relationship that you had with your partner or your spouse, but you can find meaning in friendships, in social relationships, even a romance, a romantic partner as well. So, really, if you can try to turn back to life, it won't be the same as it was, it will be different. And it really shouldn't be the same. The relationship that you had with your partner is a very special one. But if you thrived in that, then try to turn to life again and have more relationships.
Why do you think so many people don't necessarily think about how negative loneliness could be? Is it because we really haven't talked about it a lot in our society until recently? What do you think that reason is?
Why they haven't talked about loneliness? Well, I think that they didn't really identify loneliness as a problem until the pandemic. I mean, the pandemic really isolated people and isolated vulnerable populations, and we saw mental health really decline in those populations. So I think that the stigma contributed to it. I think that the fact that the pandemic came in and then it really said, wait a second, we've got a problem here that we need to address. And so those are kind of the reasons that I think that loneliness and gotten more appreciation in these last several years.
Well, and for anyone who has lost a spouse or a family member or a close friend, what does grief look like for people? Like, what
Well,
do you see?
so grief is a normal emotion that anybody experiences who experiences loss, right? If you lose something, you're going to experience grief. But we also know that human beings are naturally resilient. They turn back to life. However, some people aren't able to. And if they're not able to, what does that look like? If they're not able to resume in some capacity to find some purpose and some joy in life, then I really think that they would benefit from talking to somebody and addressing how they can best live the next chapter in their life. So, they have so much more to contribute in many different ways. But sometimes when you are stuck in grief, when you're stuck in your loss, it's too hard to look at anything else. So, talking to somebody about that, talking to a peer, but also talking to a therapist might be really beneficial.
And when we talk about mental health for seniors, what is it? How do we talk about it? And then how do we help people to stay healthy?
Yes. So when we talk about mental health for seniors, we need to be really cognizant of the two major mental health disorders that there are. We need to be aware of what those symptoms are. So the two most common mental health problems in the senior population are anxiety disorders and depression disorders. Now, those two are separate disorders, but they do have overlapping symptoms. What does anxiety look like? Anxiety looks like a feeling of being afraid or nervous or worried, and it's too strong for the situation. Having a depression looks like sadness and irritability and a depressed mood and a lack of interest in things. And those are the two common disorders. Now, they overlap because both disorders show that there are sleep problems, there's personality changes, and there are changes in the eating behaviors. Here's the good news is most often when someone is feeling a chronic stressor, they start to feel anxious and they start to have anxiety. Here's the great thing. Anxiety is the most common and the most treatable mental health problem that there is. The problem is when we feel anxious, what do? We withdraw and we isolate. And that's when a depression disorder can get in. Because, like I said before, we are we thrive in relationships. We are naturally social people. We need each other. And so that's kind of the two things that pop up. And we need to be really aware of what they look like so we can do something about them.
Well, and I think, again, just like we talked about earlier, when you talk to the people that you trust and open up, like shame cannot live when spoken out loud. And so I think that is, shame is such a thing that I think so many people feel on a regular basis when we talk about mental health. And like we said earlier, what if I'm the only one? But I think that there is so much therapeutic value in actually sharing what we are feeling and being vulnerable with people we trust.
I couldn't agree with you more. And I think that if you are willing to take one step in that direction, you're going to find commonalities with people that are similar to you. So, whether you're living in a community and you're suffering from some sort of oftentimes our body betrays us when we become seniors. We've got knee pains, orthotic pains, and sometimes we can talk about that to somebody that we can trust. And that might be an easier one to talk about. You see, I started with physical health, and then I say, oh gosh, I had that hip problem too. It's the worst. And then talk about sometimes, okay, that felt good. I could communicate with somebody. Well, wait a second. Maybe I could also talk about the anxiety that I'm feeling at nighttime when I'm alone. Sometimes people feel anxious at night. And the other person says, you know what? I felt that way too. What are some things that you can do about that? And you can kind of brainstorm together. And I think you're right. If we speak about what's happening to us, we'll find that we are far more common with each other and we can be more supportive of each other.
Well, and seniors sometimes devote their lives to taking care of their spouse. And then when someone passes away, they feel like they've lost all of the social structure in their life, leaving them, I saw this in family members of mine, lonely and alone and anxious. And so in your experience, what is the best approach for someone that's in this scenario?
Well, first of all, caring for a partner or a spouse that has needs long-term care can be a very challenging situation. Devoting your day to caring for them and your time, and I really want to encourage all of you to also take care of yourself if you're a primary caregiver. That means having specific time where you go for a walk, connect with friends, go and play cards. It will boost your health, your mental health, and you know what? It'll make you a better caregiver. So it will benefit your partner as well. So if you have those routines in place and you've lost somebody, you never lose that support from those other groups. So I really encourage everybody to take care of themselves and to try to stay connected. And after you've lost a partner, expect to feel a period of grief. That's natural and normal. It's just when it goes on for a too long period of time, say 2 to 3 months, if you can't find a purpose to the next chapter of your life or some sort of joy, that's when it's time to go talk to somebody.
Well, and how can you find purpose and joy in those situations? How can people start to find that if they feel like they've lost it?
Well, I gotta say, I adore seniors. I was raised by several of them, and I think that seniors have seen so much, they've experienced so much, and they have so much to contribute to the rest of us. So I think that sharing their experiences, maybe mentoring somebody younger than them or helping their grandson, transition to the next stage in life or talk to them about what their stage of life was when they first had children or when they transitioned a job, they can really contribute. And we know that when we have purpose, we feel better. Human beings are meant to have purpose. So I think that might be a great way to help that.
It's so interesting you say that. I think about as my grandfather got older, and he passed away a few years ago, but several years before he died, I just sort of to start to have this feeling that this is probably going to come in the next couple of years. So I started asking him questions, and I would just record it just to hear what he had to say. And now for my family and I, that's some of the most treasured videos that we have, is just him sharing his wisdom and knowledge of everything he saw over his 92 years. So I totally agree with you.
It's totally comforting, and you can continue having a relationship with them in a different capacity that you really didn't know about. Yeah.
What are those three things? I know you and I talked about that a couple of weeks ago on a call, but what are the three things that people should, when you're looking for hope, what can they do?
Well, hope is kind of the idea of happiness, right? And people have wanted to feel happiness since the beginning of time. Who has not wanted to be happier? It's interesting. I was doing a lot of research. I just recently wrote a new speech on happiness, and I discovered, there were philosophers and writers writing about it in the 16th century. And they knew what brought us happiness. And today we have the science to back it up. If you want to live a happy life, you must have three things. You must have something to do, someone to love, and something to believe in. Now, something to do is a purpose to your day, and it must be in the service of somebody else. Now, what does that look like? Well, that could look like, in my case, my grandmother having purpose in helping raise me as a child. It also can look like a bricklayer having purpose in building a home so somebody has a space. It can look like a senior contributing their knowledge and their wisdom about the going through the corporate America, those sorts of things. Sharing something for the benefit of somebody else is the purpose. You must have someone to love. Now, this can be a partner, it can a spouse, but it also can be someone to love like a friend, a grandson, a granddaughter, a child, those sorts of things. Funny enough, the research shows that someone to love can also include a pet. Have you ever met a pet parent? They love their pets and
Yes, they
feel
do.
like they are their family. And the research says that they are. So you must have something to do, someone to love, and something to believe in.
Yeah.
Now, that is like something bigger than yourself. That is something that zooms you outside of your everyday life, that gives you a different perspective. Now, religions have sometimes thought of this as God or Jesus or Allah or Yahweh or Buddha, but it also can be in a belief system, like a belief system in nature or in a meditation or in a philosophy. So, again, if you want to live a happy life, you must have something to do, someone to love, and something to believe in.
I love that. That is so good, Gretchen. It is so good. Now, as we've talked about, this can be a really difficult topic to broach with our older loved ones. How can we go about opening up a really effective discussion around mental health?
Yes. So I think that the best way to go about it is with empathy and understanding and openness, and to stay away from kind of triggering words like anxiety or depression. Make a comment that you notice some behavior changes or some thought changes or some emotional changes. So it might look like this. Hey, Dad, I know that you've lost mom and this is a really difficult time, but I also noticed that you're not leaving the house. What can I do to be helpful to you? And what it does is it opens the door to start a conversation. It might also look like, I notice that you're feeling very anxious when we go out, or you're feeling anxious when I talk to you on the phone. Can you tell me more about it? Now, here's what I really want people to do. When you open that door, allow the other person to talk. Don't
Yes.
interrupt, don't problem solve. And here's why. Well, here's our natural tendency. You know what? When my child comes home and he's had a rough day and he tells me somebody's been not nice to him on the playground, what do I want to do? I want to problem solve to make him feel better. But here's the problem. When we do that too quickly, sometimes we invalidate the way someone is feeling and they escalate in their emotions.
Or they shut
So,
down.
or they shut
Yeah.
down. Good point. Yes, they escalate or they do shut down. So here's what I think the best thing to do is open the door and listen, listen, listen. Let the conversation just flow. Ask open ended questions and just keep asking questions and see where the direction takes you. You'll know when it's time to problem solve. And then that can be great too. Mom, Dad, what could we do about this? What would you think would be helpful? And then you can make some suggestions based on like the self, maybe getting better sleep, maybe moving their body, maybe having a little more fun, and maybe eating better, those sorts of things.
Yeah, absolutely. What are some anxiety and depression symptoms that we can watch out for?
So, anxiety is kind of the what ifs. What if this happens? What if that happens? People who are feeling anxious, what happens to them is their amygdala in the back of their head fires up so much that they can't get to the logic, which is in the frontal lobe. So they make all these they say all these things based on emotion. And that's what anxiety people look like. They tend to buzz around, they can't relax. And so those are the things, they have rambling thoughts. Those are things we need to keep an eye on. For depression symptoms, it's characterized mainly by a depressed mood, but also feelings of guilt and worthlessness and hopelessness and not looking forward to the future. It can also be talks of like self harm. So those are those two symptoms, and that's what we need to look for out for. Any changes in personality, sleep changes, those sorts of things. Here's what I really want to impress on everyone. The sooner you get those symptoms addressed, the the sooner they're resolved and the sooner we can put them in the past. And the sooner somebody can resume or continue having a happier life.
Well, and I would add to that just also looking if they keep isolating or if you
Yeah.
feel like isolating. I think that's something else to look for too.
I think you're right. It's interesting. The anxious person isolates because it brings down their anxiety, right?
Hmm.
If you've been invited to a dinner party and you're feeling socially anxious and you don't go, you temporarily feel better. But now you've missed out on relationships and all of those sorts of things. Now, the depressed person tends to isolate because they can't muster up enough energy to get up and go. So isolation, you're right, is a huge sign of something going on.
Well,
And that's across the age groups.
absolutely, absolutely. So earlier you touched on the idea of happiness, and I've noticed that people tend to be happy when they feel a sense of purpose. So what's something we can do to help our loved ones rediscover their sense of purpose if it feels like they might have lost that?
Yeah, I think having a sense of purpose, originally in psychology, we thought of human development stopped when you were an adult. And I couldn't disagree more. I think that development and purpose is for the entire lifespan. Sometimes it's hard to see your purpose when the rug gets pulled out from underneath you, when things change drastically. So I really encourage people to start to explore what could give them meaning again in their life. Now, it might be volunteering. We know that volunteering improves mental health significantly. That might be volunteering in your senior community, or it might be volunteering in your church or your synagogue. We know that those sorts of things really tend to improve mental health.
Well, you talk, about having a purpose, and I think so often that can come from being around other people, but not everyone has or takes the opportunity to be around people. So what is the difference between loneliness and just being alone? I want to make sure we cover that
Understand
again.
that?
Yeah.
Yes. So being alone is a physical state, right? Not having other people around you. And we all need our alone time. I included. I need some alone time from everybody.
Yes.
But being lonely is an emotional state. That's when we desire to be with others and we don't have the others to be with. Now, it's very interesting. Somebody, for example, who's taking care of their partner who might have dementia can feel lonely despite not being alone because they don't have that connection. Human beings thrive in connections. That's what really drives us. That's what keeps us healthy. That's what keeps us motivated is our relationships with other people. So really fostering those would be the best thing to do. So how can you get involved? And that might be, I mentioned volunteering. It might be doing something for somebody else. It might be, going back to work in some sort of capacity, like being a mentor. I know that there are so many young people in this world who are also feeling lonely. And
Yes.
you'll find that if you reach out to them and maybe mentor them through their career or their relationship, they will feel connected, as will you. There's another adage my grandmother said, it's in giving that we receive. And it's so very true. The more you give, the more you get. So finding a purpose throughout the lifespan is essential.
I tell you what, your grandmother was really wise. Really
She
wise,
was.
Gretchen.
She was. I adored her so very much. And my grandfather. They were both incredibly wonderful people.
Me too. I was very fortunate to have incredible grandparents, and I'm so grateful for that. Okay, let me ask you this. So when we're lonely, I know in my past when I've felt lonely, it's really easy for our thoughts to wander and start to become negative. So do you have any advice for addressing this?
Yes. So when we are lonely, we start to feel a little blue, a little anxious, right? That's when our amygdala is firing up again. Remember, and we can't get to our logic. So the first thing to do when we're feeling lonely is to use distraction, to give ourselves a break from that amygdala firing up so our logic can kick in. So that might be going for a walk, calling a friend, playing cards, watching a cute video on, the TV, something, distract yourself. And when you can calm down, logic will kick back in. And here's what I want you to do. I want you to practice the idea of catch it, check it, change it.
Mm.
This is a strategy to use when you find yourself in those negative cognitive loops that you can't get yourself off of. So let me give you an example. You get invited to a social engagement. Let's say you get invited to go have coffee with your friends and it's a group. And you start to feel a little off, maybe you're feeling a little anxious. And you say, oh, I'm not going to go. I've got nothing to say. I saw them a month ago. No one's going to care if I go. And you don't go. Now, wait a second. Here's where I want you to catch yourself. You get invited to a coffee and you start to have a negative thought. A change in your mood is the biggest indicator that you're having a negative thought. And your thought is, I've got nothing to contribute. I want you to check that thought.
Yeah.
Wait a second. I went 2 weeks ago and I actually had a really nice time. We got laughing so hard and then we got distracted and we were talking about the table next to us. And then we got talking about the baseball game. And you know what? I was shocked what a nice time I had. So you see how I check that thought
Mm-hmm.
and then I change it. Okay, so you get invited, you feel a little blue, you don't want to go, you're feeling anxious about going, you have this negative thought. I must change that thought. Okay, I got invited, I didn't want to go. Why didn't I want to go? I think I better brainstorm that. It's not because I'm not interested or I don't have something to say. Something else must be bothering me. Maybe it's that first conversation. Maybe I should walk in and have two or three topics of conversation in my back pocket so I can talk about it. So really catch yourself having the negative thought, check it and change it. The change it, and this one is, wait a second, it's not that I don't have something to say, it's that something else is hindering me from going out and experiencing that.
What I also love too, one of the things for me, if I start to get frustrated or feeling lonely or just start to have negative thoughts, one of the things that really helps me is just to get outside, get on a trail and walk. And there's something about that repetitive pattern with my feet, whether that's walking or jogging or running, that kind of helps my brain to reset and it gets me out of whatever negative thing that I'm feeling. Do you see that with some of your patients?
For sure. You know, the research on getting outside is outstanding. Now, I can't remember what hospital it was, but they looked at patients who had rooms facing the outside compared to patients who had rooms that were interior to the hospital. And you know what they found? They found that patients that looked outside had less rates of infection, were discharged sooner, and less rates of being readmitted. And you know what? That's when they all started bringing greenery and vines and palm trees into
Yes.
hospitals. Have you ever walked in and seen all that? That's because the research says being outside is so important for your physical and mental health. So I say get outside every single day. I don't care what the weather is, even if it's just a quick walk around the block or something like that. Being outside in greenery, and actually there's new research that's showing that water is especially helpful to look
Yes.
at water to improve mental health. So try getting outside every single day. We all have access to that.
I love that you said something about being close to water. I literally just saw a stat about that this morning of how
Oh,
helpful it could be for our mental and emotional health and just calming our nervous system. I can't remember exactly what it was, but I love that you said that.
it is where it's not exactly clear why water is. Now, new research are trying to figure out, is it because it's blue? Is it because it has emotion to it that it's calming? But they're trying to investigate it. Either way, for us, let's get outside and let's be in the greenery and let's look at some water.
Well, so let's say you've tried those things and you're still really struggling. When is it time to engage professional help? And how should someone go about talking with your loved one about this?
Yes. So let's say you've tried all these things. Let's say you've tried, catch it, check it, change it. Let's say you've looked at yourself, sleep, exercise, leisure, food, and you're still feeling blue. It's time to go see your physician. Now, why do I say physician first? Well, sometimes you can have an underlying medical condition that can look like an anxiety or depression. Let me give you an example. So, thyroid disease, people whose thyroid is under functioning, hypothyroidism, tend to feel depressed. People with hyperthyroidism tend to feel anxious. So, really get yourself a clean bill of health and then consider talking to somebody. It's very interesting. Cognitive behavioral therapy has been highly effective at treating the most common mental health problems, anxiety and depression. And so I always get this question, Gretchen, what's more effective, medicine or talk therapy? And here's what the research says. It was a meta-analysis. They looked at hundreds of research, and it said that talk therapy, particularly cognitive behavioral therapy, is more effective than medicine, but the two together is the most effective. So really talk to your physician about what course of action would be the best for you, and consider, talking to somebody and possibility of your physician prescribing something.
Well, and so if you guys are watching right now, I've got another question for you, Gretchen, but then we want to transition into the Q&A. So if you are sitting at home watching this and you have a question for Gretchen, make sure you put it in the chat now. But Gretchen, I heard you've been doing a lot of research recently on the subject of happiness, which is obviously strongly related to our topic today. So what have you discovered about the keys to happiness in life in your research?
Well, what I like most about it is that happiness can happen to anyone at any stage in their life. It's an investment in yourself.
Yeah.
So, gratitude plays a huge role in this, personality plays a huge role. But again, it's the idea of having a purpose in your life, someone to love, and something to believe in that takes you outside of yourself. Happiness is something that is attainable for everyone. I always get this question, Gretchen, does money buy happiness? I always get that question. And I say, well, it does, but only to a certain degree. If you make like $75,000 or more or less, or I'm sorry, or more, you're no different happier than anybody else. So it's really people, our society tends to focus on these external things to bring us happiness, sometimes fame, sometimes money, those things. But really, we know that happiness is an internal state. So if we can find some purpose and some joy in our life, that will bring us ultimate happiness.
Okay, so we have covered a lot today, but before we transition to our Q&A here in just a second, I'd love it if we can just do a quick summary of the things that we've discussed so far. What are some of the basic things we can do to take care of our mental health?
So some of the base things you can do every day, check yourself. Make sure you're getting enough sleep. Make sure you're exercising. L is for leisure and F is for food. Am I getting enough sleep? Am I moving my body? Am I having some fun every single day? And am I eating the right foods? Also consider practicing gratitude. When we focus on what is going right, we have less energy to focus on what is going wrong. So really focus on the things that are going right. Another great thing that I have all my patients do is journaling. Journaling is a highly effective way to improve your mental health. It's almost like having a therapist there right there with you. Here's what it is: it's simply writing down your thoughts, your feelings, and behaviors, and it kind of takes you on a journey of gaining insight to why you feel the way you did, why you behave the way you did, and what you're thinking about. And you will create these aha moments. And it might look like this. I walked into the store today and I was so irritable and I didn't know why, and I was short with the cashier, and then I was ashamed of it. And I'm really embarrassed. How can I? And it starts to kind of take yourself through these journeys to better mental health. So those are some great things that people can start doing today.
So one of the questions we have in the Q&A is, what if you're feeling lonely in a house full of people? What do you do?
Oh, that's a great question.
Great
So we
question.
talked, it is a great question. So if you're feeling lonely in a house full of people, that means you're not connecting with the people that you're living with. You must find a group that you connect with. Now, that might be something that people have in common. So that might be a group that people have a common hobby, like playing cards or knitting or something like that. It also might be stepping outside of the people that you live with and going and doing something that you believe in, like maybe attending church or a synagogue or a temple. You must find people that are like you to share common feelings and to share common thoughts so you feel connected. But I got to tell you, you're not the only person that I've heard that lives in a house full of people but is feeling lonely. It means you're not connecting. You might also consider starting a conversation with the people that you are living with. I mean, how much do you know about them? How involved are you in their lives? Sometimes I always like people to try to start to connect with somebody by doing something for that person. So that might be like making an extra cup of coffee for somebody and bringing it to them on the couch. One act of kindness can start a conversation, and a conversation can start a connection, and a connection can start a relationship. So it can be twofold: finding people outside, but also trying ways to connect with who you're living with.
I think this next question is a really great question that so many people that are watching probably are thinking about or feeling and don't probably necessarily want to say out loud. But how do you deal with the feelings of anxiousness around living on a fixed income or living with less than you used to have?
Yes, that's a tough one. Living
Yeah.
on a fixed income and the stressors of that. And also, what was the last part, Ashley?
Or living with less than what you used to have.
So that's really funny, living with less than what you used to have, because it comes. I was doing some research, and the Dalai Lama, the 14th Dalai Lama right now, was talking about gratitude. He was talking about happiness. And he said, the key to happiness is being content with what you have and also being content with having less. If we can find joy with having less, we could be happier. And it's kind of this new philosophy that I've started to kind of think about and started to explore. Could I be happier with less things? Here's what else we know. If we know that happiness really comes from a purpose and from something to love and something to believe in, those things are not based in money. Those things are based in our internal, systems and rewards. So consider, finding your purpose, finding someone to love, and something to believe in outside of yourself, which is independent of an income. Now, I do really feel for you if you are stressed about your income. Consider also talking to people around you. How else have they coped with a limited income or a defined income?
So we have another question for the chat that I think is really good. It said, speaking of your friend who suffered from a fear of throwing up, I have a close friend suffering from that condition as well. How can you support a friend who's dealing with a long illness and is depressed?
Yes. So, if you have a friend that's dealing with a long illness or depression, empathy goes a long way. Showing love and compassion and support goes a tremendously long way. And then when they feel that, helping them mobilize to do something. Well, you could also say, maybe you benefit by talking to somebody about what you're going through. Maybe somebody might have some insights in dealing with something as difficult as you are. But we all know that when you are dealing with somebody who has a long-term illness, you must also take care of yourself. You must also take time away to recharge, to rejuvenate. Ashley, you said yourself, you get that recharge when you go for a walk in the forest outside, that does it for you. So really expressing empathy and concern, helping them mobilize one step to going and talking to somebody to see if there's some other way at looking at the situation. But also, please remember to take care of yourself.
Yes, absolutely. We can't take care of other people if we're not taking care of ourselves. I know that to be true. So, we talked earlier about veterans and some of the life experiences that they've had. Could you share some resources that they or anyone else that needs guidance on this topic that they might be able to access?
Yes, so there's a lot of great resources for mental health today. The first one I'd like to talk about is 988. That's a crisis line that anybody can call at any time. It just came into the United States last year. We have 911 for physical emergency situations. 988 is for mental emergency situations.
Yes.
And here's what I want to be clear about is it's not only for the person who's in crisis, it's also for the person who's helping the person in crisis. Like, what do I do about my friend who, that sort of thing. So that's a great resource. The American Psychological Association, if you go on their website, also has great resources for different mental health professionals. Another one is psychologytoday.com. That's the one that I really recommend. People can vet different mental health professionals. Maybe you want to see a man, or maybe you want to see a woman, or maybe you want to see a specialist in PTSD, those sorts of things. Also, which I'm really glad to say is because of the pandemic, telehealth has really taken off. And it is here to stay, which I'm so pleased about because so many people who needed access to care that couldn't get to it now may have it. There's this thing called Psych Pack, and it says that I think there's about 42 states now that participated, and you can have therapy sessions in the privacy of your home, across state lines. So there's really a ton of resources. The VAs are also very helpful, as are the AARP is also another great resource to find mental health support.
Gretchen, this has been the most incredible conversation. Thank you so much. On behalf of so many people that are watching, we are just so grateful for your time today and sharing so much valuable information.
Thank you so much. I'm so pleased to be here. I do adore seniors and I want to be helpful to you all. If I could wrap things up today, this is what I would say to you. We talked about several different things you can do to improve your mental health, whether it's cut down on that caffeine or move your body or get outside or call a friend. What is one thing that you can do today to improve your mental health for tomorrow?
Gretchen, thank you so much for being here today. You can learn more about Gretchen at the links that you see here and right here on our screen. And then for people who are watching at home, this webcast will be available to watch again at any time on the Brookdale YouTube channel. So please share this with your friends, family, caregivers, and anyone else that you think would find it helpful. And join us on July 31st at 3 p.m. Central Time for our next webcast, Small Space, Big Possibilities, Designing with Purpose. We'll be joined by designers Kim Lewis and Ronica Clifton, who are both experts at making your space work for you, and they'll be here to discuss strategies for downsizing. It is going to be a really fun conversation, and you can register for this event at brookdale.com/webcast. Thank you so much for joining us on Grateful Life. We'll see you soon.